Değerli meslektaşlarımız,
distinguished colleagues,
sevgili izleyiciler,
distinguished audience,
pandeminin yılı dolayısıyla
on the occasion of the first year of the
bugün
pandemic,
itibariyle özellikle insan, doğa
especially
ve
on
bu
human
pandemi
nature
sürecinde
and the pandemic,
yaşadıklarımızı paylaşacağımız bir
will be our main topics to discuss throughout these
hepinizi
panels.
burada karşılıyoruz dostlukla
I would
ve
like to
umuyoruz
express
ki
my warmest regards to
pandeminin
all of
birinci
you.
yılı
Hope
sonunda
that
öğrendiklerimiz
what we have
önümüzdeki
learned
günlere ışık
from
olsun
the first year of the
ve
pandemic will shed
bütün bu
light on our
günler
future,
boyunca
and
birlikte
we will
tartışacaklarımızla
discuss
geleceğe dönük daha somut
many
adımlar
issues
atabilme
so that we can make
kısmetse bu
concrete
arada
recommendations for the
bizler
future. In this period,
pandeminin yoğunluğu içinde pek çok
we
deneyim
have
ile
learned
karşı
a
karşıya
lot, we have
kaldık ve
experienced a
bu
lot while
deneyimleri
dealing with the
aktarırken de
pandemic. And
bir yandan
on the one hand,
aslında yalnızca sağlık ortamının değil,
it is not only
hayatların
for
nasıl olmaması
right to health,
gerektiği üzerine
but we also learned
düşünerek hep
what
birlikte
should be the world.
çözümler üretmeye gayret ettik.
And we have been
Tabii
doing our
pandeminin
best to
geleneği
suggest solutions. We, as the Turkish Medical Association,
ve hayatlara dair, topluma dair sağlığı toplumsallaştıracak
have been
mekanizmaları kurmak
working
üzere
on mechanisms to
bir
solve the
hedef
health
koyduk bu
problems as
gelenekle
well
ve bu
as
gelenek
to make recommendations for a better society. This is our tradition. This is how we have been working
çok
for
önemli bir birikim
years. We have
Türk
an
tabipleri birliğinin
important
çatısı altında
experience
gerek
in this
Türk tabipleri
organization,
birliğinin
both as the Turkish
oluşumunda
Medical Association
kurullarıyla
and
birlikte
our working groups,
gerek
our
tabip
units and
odalarımızın
branches,
kendi
as well as
kökünden
the
doğmuş
chambers,
üyeleriyle beraber biz
which
bunu
have learned in
hayata
this period in their own
geçirmeye ve
provinces.
hayatı dönüştürmeye
We try to
gayret
realize
ediyoruz
all
uzun
these
yıllardır.
experience in our
Pandeminin
activities.
birinci yılı ile birlikte de
On the occasion of the first year of this
yeniden
pandemic,
hem sağlık ortamını hem de hayatlarımızı tartışacağımız biçime nasıl dönüştürebiliriz
we
diye
are thinking about how to transform all these issues. Due to the extra voice, I can't interpret. This COVID-19 pandemic
hem çok ağır tablolar
has
gösterdi ve
caused a grave
bizler
violation
dünyada
and
hem de Türkiye'de
serious numbers of deaths,
insanları yitirdik.
both in Turkey and
Sağlık
in the world.
kurumlarında
We lost
yaşanan
people.
zorluklara tanıklık ettik.
We have
Sağlık
witnessed the challenges
çalışanlarının
in
yaşadıkları
health institutes,
zorlukların
and also we
çözümünü bulmaya çalıştık.
have been
Ancak
trying to solve the problems that our colleagues
tüm dünyada
faced.
neoliberal
Unfortunately, due to the neoliberal patriarchal
sağlığı piyasaya
capitalism, which imposes the
süreci
commercialization of the health,
bize bundan sonraki olası pandemilerle birlikte
demonstrates that
karşılaştırdı ve ne yazık ki
we
böyle
can
bir
have similar
süreci
problems in the future
yaşamak zorunda
pandemics.
kaldık. Onun ötesinde tabii
Unfortunately, we are dealing with these issues. Moreover,
böyle bir ortamda, sağlığın piyasaya açıldığı bir ortamda gerçekleşmiş olması nedeniyle
in an atmosphere
bedelini bütün
that the
dünya çok ağır
health
ödedi.
sector
O yüzden
is
hep
open to
birlikte
market,
bilim insanları,
we have paid a huge
özellikle
price.
sağlık alanında
Scientists, especially health
aktif sağlık
officers
politikaları
and
üzerine
active
çözenler,
experts who
çalışanlar,
have been specialized
düşünürler,
in this
sosyal
right to
bilimciler,
health, scientists and
sahada
experts
tüm
of
çözümleri,
humanities
görünmez kılınanları ortaya
have been
koymaya
working
çalışanlar
on
bu sempozyumda birleştiler.
several issues, how to make these inequalities, which are already invisible, to make visible. I would like to thank everyone who has made contribution to this panel and to these activities in general. I would like to thank our Ankara branch for its particular efforts to organize this panel. And it is the first time that we are organizing a panel which is broadcasting and also we have simultaneous interpretation in 2 languages. In one channel we have Turkish interpretation on our YouTube channel that is run by the Executive Council, and in the channel run by the Ankara Chamber we have English broadcasting. It is the first anniversary of the pandemic because the Ministry of Health reported the first case here in Turkey on 11th of March. We as health officers know that there were cases before 11th of March, but they have not been officially reported. And it has been named on 11th of March 2020. It is the first year that we have documented the pandemic. Today, we organize some activities to raise our concerns and also share the figures. We organize several other activities to commemorate our colleagues, to make our assessment, to share assessment with the public. Our dear colleague, Esat Ülkü, who is the president of our chamber in Izmir, and his daughter, who is also a physician, shared her experience with us. We are not losing people only. We are also losing their contributions to this world. And all these problems, all these deaths can be prevented. So as not to face new pandemics, we should discuss what to do more, what to do in the future. And we will discuss how to find a way to overcome this pandemic, how to exit from this pandemic. I would like to thank everyone in this respect. And I would like to thank also a special colleague, since it is not only for health officers. This panel is a program that we achieve through receiving support from all colleagues. I would like to thank the technical team which is making contributions to this broadcasting, and also I would like to thank our simultaneous interpreters for their efforts and contributions, for their support, for standing with us in these difficult periods, because your support is felt throughout the country. And all your efforts, all your struggle is felt here. Now I would like to give floor to David Barr. He is the president of the World Medical Association. We will broadcast his video so as not to face any technical glitch. Yes, we are going to watch his opening remark now.
Good evening. I'm Dr. David Barb, President of the World Medical Association, and I'm very pleased to be part of the kickoff of your first year in the pandemic symposium that you will be hosting this week. I commend you for hosting this. It is very important for us to bring together physicians to discuss what we have learned this year and what we must do to continue to manage through this pandemic and to be prepared for future pandemics. This is not the first pandemic, and it will not be the last. I also commend you for the strong advocacy that the Turkish Medical Association has done on behalf of the people of Turkey
zorlu
to
koşullarda
assure that there
çalışan
are adequate
meslektaşlarımıza
PPE,
yeterli
that there
kişisel
is
koruyucu
good
ekipman
vaccine
verilmesi ve
supply and
aşılamanın
distribution
dağıtımının ve gerekli
for
düzeyde
safety
aşılamanın
of your
yapılması için
fellow
yürüttüğünüz
physicians as they
faaliyetler
work
için de
under very
tebrik
difficult
etmek istiyorum. Bu
circumstances.
nedenle
So thank you for your
hekim
advocacy
meslektaşlarınız
on
ve
behalf of
hastaların için
physicians
yürüttüğünüz güçlü
and your
savunuculuk ve
patients.
çabaların için teşekkür ediyorum.
We do admit that this
Şunu
pandemic
biliyoruz.
is
Bu
unprecedented
pandemi
in our
bizim daha
lifetime.
önce
As you
kendi
know, there have been
yaşamımızda denk gelmediğimiz bir
117 cases of the
salgın olduğunu
coronavirus
biliyoruz.
illness worldwide.
Dünyada 117
That has
milyon
resulted in
koronavirüs
2.6
vakası var ve
million deaths
2,6 milyon
worldwide.
ölümle sonuçlandı.
There in
Bunu sizler de
Turkey,
biliyorsunuz. Türkiye bakımından
2.8
ise
million
2,8 milyon
cases
vaka
and over 29,000 of your friends and your relatives and your patients have died from this COVID disease. However, Turkey in some ways has been spared. That 29,000 death rate represents about 348 deaths per million population in Turkey. Many of the surrounding countries in Eastern Europe and Western Asia have been hit even harder. As you may know, some countries have 1,500 or up to 2,000 deaths per million. So you do have something to be thankful for in Turkey. Also, the vaccine rollout is going relatively well in Turkey and in some other countries. Worldwide, over 300 million doses of the vaccine have been given. In Turkey, about 10 million doses have been given, and about 2.4 million of your friends and relatives and your patients have been fully vaccinated. About 9% of your population has received one dose of the vaccine already. So I encourage you to keep up your good work on promoting vaccines, in trying to counter the vaccine hesitancy that many patients around the world have. So keep up the good work. I also want you to know that the hard work that Turkish physicians are doing and that other physicians around the world are doing is being recognized. The World Medical Association recently received a very prestigious award called the Golden Arrow Award, which is presented each year by a group called the Vienna Congress. All of the previous recipients have been individuals, but for the first time this year, an organization, the World Medical Association, received that award. And we received the award because they recognize the hard work and the danger that physicians have experienced as they have battled COVID around the world. Let me read briefly from the remarks I gave to the Vienna Congress when the WMA received the Golden Arrow Award on behalf of physicians around the world. I told them that physicians have been vocal advocates for patients and our colleagues in calling for adequate personal protective equipment, improved access to hospital care and equipment, life-saving treatments, the rapid deployment of vaccines, and responsible social policies to reduce the burden of disease, save lives, and to bring an end to this devastating pandemic. But I went on to tell them that physicians and other healthcare workers have been in an especially challenging situation. Our very calling and our service to our patients have exposed physicians to the risk of COVID in ways that few others have experienced. But physicians have demonstrated their professionalism by willingly placing themselves in grave personal danger by caring for patients with COVID, often under less than ideal conditions. As a result of this, I told them that untold tens of thousands of physicians have become seriously ill, and thousands have died as a direct result of their commitment to their patients and to society. I also told them that receiving this award on behalf of the World Medical Association and physicians around the world filled me with deep emotion for a reason that they probably didn't expect. Because they can't see this from the outside. But there are many physicians around the world, and I'm sure there are some in Turkey, who do not feel appreciated or supported for the risk that you have taken or the sacrifices that you have made in caring for patients with COVID. Many physicians are demoralized. Many feel that their governments, and in some cases their hospitals, have let them down. Some feel taken for granted or even taken advantage of. The Golden Arrow Award claims to the physicians of the world, you are appreciated, and they recognize all you have done, and they thank you for the sacrifices you have made. I told them that physicians needed to hear that. You need to hear that. And I told them that I would tell you and tell other physicians around the world that they are appreciated. I want to end my remarks with one more appreciation for the Turkish Medical Association. The World Medical Association is very, very proud of the Turkish Medical Association and how you defended your former leader, Dr. Gokap, when he was taken into custody and imprisoned due to political problems in your country, and that you stood beside him and you contacted the World Medical Association, and we supported you, and we wrote letters to your Minister of Justice and also to President Erdogan, urging them to drop the charges against Dr. Gokap. And as I understand it, as of now, he has been released, and I hope that this is the end of his problems. I also commend you for defending the Turkish Medical Association against the efforts of the government of Turkey to weaken your position or to discredit the Turkish Medical Association. So we are proud of you. Continue to stand tall. Continue to advocate for your physicians, for your patients, and for the medical system in your country. I thank you for the invitation to speak. I hope that you have a wonderful symposium, that you learn from one another, and that it encourages you to continue the fight against this terrible pandemic. Good evening, and have a wonderful symposium. Thank you.
Evet, sevgili Doktor Barb'a çok teşekkür ediyoruz. Gerçekten
We would like to thank Dr. Barb. He has supported us, and the World Medical Association supported us in this struggle. It has been standing with us. Whenever we make any effort to reveal the truth, we receive some attacks, and the World Medical Association stands with us for a long period. We feel its support. We would like to thank him for this support. I know that I heard that there was a technical problem with the translation, and I heard that both English and Turkish voices created some confusion. I hope that we will solve this problem because it is the first time that we are trying to broadcast in two languages. So we may face some technical difficulties, but I hope that we will not face any problem in the course of the panels. Hope that it is because of the video, because we wish that there will be no technical problem during the next 9 days. We will listen to very valuable panelists and hope that you will be able to participate in discussions. Of course, Dr. Barb shared some official figures and said the situation is relatively good in Turkey. But we know that, as we stated today, while we are making our assessment on the first year of the pandemic, we have been facing grave violations, and we try to get a deeper understanding of the situation through reading these figures, because unless you know the truth, you can't take required measures, and you face certain difficulties to overcome these challenges. On the first year of this pandemic, we will discuss the broad spectrum of the COVID-19, and the moderator of this session will be Professor Dr. Pınar Saib, who is my dear colleague. We studied together, so she is my dear friend as well. I would like to give floor to her now and hope that it will be a fruitful session for everyone.
Sesin kapalı Pınar'cığım.
Mic, please.
Mikrofonu.
İyi akşamlar, selamlar Şebnem.
Good evening, everyone.
Başkanımız, Türk Tabipleri Birliği'nin sevgili
Dear
başkanımız.
President of the Turkish Medical Association.
Sosyal bilimcilerle de birlikte hazırlanan bu geniş,
In fact, it is a very broad
bu ilk oturum,
and
yani bütün bu sempozyumun amacı
substantial
aslında insan ve
session, because we discuss
pandemide
human nature and our future. Unfortunately, as in the case of the whole world, our country failed too. We will discuss the reasons and factors and its relation with the capitalist system and the patriarchal system's impact on this failure, and what to do more for the future pandemic, how to achieve a more resilient society in the future, how to improve and advocate the public health. We will discuss all these issues in a very detailed way. We have two esteemed panelists today. We have Rosa Pavanelli. She is a biologist and she studied biology at Milano University in Italy. She worked in the trade union movement, and since 2012 she has been serving as the General Secretary of the PSI. Now I would like to give floor to her, and I would like to thank her for accepting our kind invitation. Yes, the floor is yours.
Good evening, everyone, and thank you very much for inviting me on this very special occasion of the first anniversary of the COVID-19 pandemic. I'm not a physician, so I cannot rely on your experience, on your direct experience, but I've been working all this year in close relationship with our affiliates around the world. In PSI, Public Services International, we represent 30 million public service workers. Half of them are in the health sector, physicians, nurses, all professionals in the area. And we have been accompanying the situation the worldwide and trying to support the initiatives of our affiliates. It's true, it was the first time that in our generation we had to face such a disastrous pandemic as COVID-19 it has been, but it's also true that it was not something completely unexpected, as in recent years, since the beginning of this century, we had experience in Asia, in Eastern countries, of similar epidemics, thinking to SARS, thinking to MERS and other kind of disease. And we had the terrible experience only 6 years ago of Ebola in West Africa, where workers, professionals, and of course patients have been left alone to face such a terrible disease. So we thought that after those experiences, the world had to be prepared to face a pandemic, to face an epidemic. But actually, this didn't happen. And we saw everywhere physicians, nurses, health professionals having to cope with unbelievable situation, lack of personal protection, lack of equipment, lack of the very basic material needed to support and to assist and to care patients. That was the experience of the very first months all over the world. And it is a consequence of something that could have been avoided. And it's a consequence of the marketization, the commodification of health in so many economies. Opening the free market to health services turned out to be the disaster that we saw. I'm speaking now from Brescia, which is my hometown in Italy, in Lombardy, that has been the second most affected town in Europe in the first wave of the pandemic. And we continue now to have to deal every day with 1,300, 1,400 new cases of all the different sort of variants, the British variants, the South African, the Nigerian, and since few days, also the Brazilian one. And these variants of the virus is getting more and more contagious, and the ICU, the emergency services are really on the verge of a collapse. But I have to say that the situation in Lombardy, in my town, is paradigmatic of the world situation of the health system. Indeed, this is the region in Italy where privatization of health facilities has gone over and over in the past 20 years, where public funding for public health services has been drained by the private companies providing for-profit health services. And it was needed the intervention of the national government to impose to the private hospitals to treat, to receive, hospitalize and treat COVID patients at the very beginning. Now, of course, they are all in a mess, but this says a lot about the fact that countries that had the possibility to invest in public health system performed much, much better than countries where privatization has been imposed as a new system. It's enough to compare, for instance, what happened to New Zealand, where the Prime Minister, Jacinda Ardern, decided to invest. She said, when you are on war, you don't cut, you invest in the public health system. And where the contagion has been contained, as the impact has been much, much lower than in many other countries. Or simply to look what happened in the United States in the beginning, and what happened on the other side of the border in Canada, where a public system is performing much, much better, protecting patients in a better way, but also treating workers in the health sector with more rights and more protection. I think that these are the first elements that for all of us who deals with professionals in the health systems is something that we need to expose. We have been called heroes. Workers have been called heroes during the first months of the pandemic, and everyone celebrating their courage, their bravery, for the way they were offering their services without sparing their energies, and even under very bad working conditions. But I think that it's not enough. We don't want physicians, nurses, and even assistant cleaners, janitors, working in hospital being called heroes. We want them to be called workers, professionals that deserve their dignities and their professional capacities to be recognized and to be correctly and fairly compensated. We have been assisting in the past 20 years to rush to the bottom, where everywhere around the world, wages of health professionals have been reduced by public policies, using several issues like budget cuts and things like that, or austerity measures, or IMF structural programs. And this is something that cannot continue. This is something that cannot continue. We saw, and everybody realized, that you need well qualified, equipped, protected, and paid health professional if you want to face and being able to protect the community that you have to serve. This is the very first lesson. We are going to celebrate in the next, and in this year, under the auspice of the World Health Organization, the Year of the Health and Care Workers. And this is the first message. When I was asked by the Director General, which is the first message, I said the first message is invest in public health system. You need to train, you need to prepare, you need to hire more and more physicians and nurses and health professionals. It was 2016 when the United Nations declared that there was 40 million health professional scarcity around the world, and that we needed within 2030 to hire 18 million of them. Well, this is actually what we need to do now. And we need to invest in the health system and to qualified quality health system able to face emergency like this one for being able to protect the patients and our communities. We need then to recognize that the globalization of this globalized system of production showed to fail and in different moments of this pandemic. It showed to fail, first of all, when at the very beginning of the pandemic, in many countries, there was shortage of masks, of PPEs, of gowns, or all kinds of protection, as well as ventilators or other equipment for to treat patients. We need to see that the globalized system of production and distributions of medications, and I'm thinking to the vaccine right now, is showing another failure. Big pharma are deciding where to send the vaccine according to where they can make more profit, and big part of the world is left without the adequate access to vaccine that is needed. When we perfectly know that there won't be one nation that can save its population if all the rest of the world is not protected in the same way. And this is another critique to this model of production and consumptions that have pushed to produce where it's cheaper and distribute where it's more convenient to make profit. We appreciated the WHO initiative of COVAX as we think that it's time to limit the role of big pharma and instead support the TRIPS waiver campaign that is asking the WTO to suspend, to waive the intellectual production for vaccines in order to let the production of the vaccine happen in all the countries where it is possible. There are the facilities and the technologies to produce the vaccines and help an equal and fair distribution everywhere. We can say that your role has been key, and our governments have to remember that it's not when the pandemic will be over that what you have done as physicians, as health professionals, has to remain not only as an example of heroism, but it has to remain as a warning to all our communities that this is an essential and precious profession, and that deserve dignity, recognitions, and right at work, right in your capacity to organize and to protect yourself and to defend your rights and to negotiate, and the right to have decent wages and decent work everywhere. I would stop here, and I'm very happy to receive your questions if any.
Rosa Povinelli'ye çok teşekkürler bu konuşması için.
Thank you very much, Rosa, for the speech. Thanks a lot. Actually, you gave us a very good summary of what whole world is facing, and privatization policies adopted by many countries, particularly by the US and the EU countries, have caused the collapse of healthcare systems. That's why we have to invest in healthcare systems, and we have to ensure a fair distribution of vaccines. Otherwise, we would face many problems, and privatization would also lead to many problems. And you said that healthcare professionals shouldn't be called heroes, and I definitely agree with you. I would like to make sure that there is an order, there is a work environment where everyone is entitled to their rights. We will get the questions after we listen to two more speakers. So now I would like to give the floor to Feride Aksu. She's specialized in public health. She has worked for a long time in Ege University in public health. Unfortunately, she was purged because she undersigned a statement calling for the rights. In addition, she is also the head of the ethical board of the Turkish Medical Association. The floor is yours, Mrs. Aksu.
Merhabalar, herkesi sevgi, saygı ve dostlukla selamlıyorum.
Good evening. I would like to greet all of you with respect, with friendship and with love. I want to share some slides with you during my speech. So let me please, first of all, share my screen. Do you see my slides on the screen? Yes, please. Share it again.
Share screen'den.
Evet ama
Şu aşağıdaki yer.
kusura bakmayın. Biliyorum oradan yapıyorum ama gelmiyor.
Sanıyorum size o
Sorry for this technical inconvenience. I'm trying to make it full screen.
Görülüyor mu slaytlar? Ben görmüyorum. Kendi slaytlarımı görmem gerekir.
I don't view my own slides. You may be seeing them now, but I don't see them.
Tamam oldu hocam.
Çağlar yardımcı
Oldu.
olabilir.
Feride hocam oldu şu an.
Oldu mu?
Feride Hanım, we see your slides. Yes, okay, perfect.
Özür diliyorum.
Sorry for this technical inconvenience.
Halk sağlığı bakış açısıyla pandeminin durumuna, ağırlıklı olarak
I'm going to talk to you about the developments since the beginning of this pandemic, and I will focus on the situation in Turkey. But of course, I'm going to use some global figures in my speech. Pandemic is an extraordinary situation which is caused by man, which is man-made. So it's not any plot,
kapitalizm tarafından
but it is caused because of the fact that natural resources are exploited and destructed by capitalism. Ecology is destructed, and that's the reason, and it's also a result of the capitalism. So it's a man-made disaster, and it has penetrated into our lives with many uncertainties. It is a known fact that zoonosis may lead to pandemic, but with many uncertainties, this virus has penetrated into our lives, and the global figures change every day. 117 cases and more than 2.5 million deaths. These are the figures related to the COVID, and it's a health problem caused by capitalism. So during my speech, I'm also going to talk about some aspects of the sovereign ideology. Are we still on the same boat? Is it true that we are all in the same boat? No, we are not. Yes, this virus may infect anyone, but there are communal determinants of health which have an impact on the conditions, social conditions. They were already crippled by capitalism. Our social and economic conditions were already very problematic for the majority of the society. And this situation has aggravated, has deepened and got worse because of pandemic. Unemployed people, people without any social security, refugees, in other words, the disadvantaged segments of the society were hit hardest by this pandemic. So women were already suffering from violence, children were already suffering from lack of education, old people were already suffering from discrimination against the elderly, and this situation, already bad conditions were aggravated by pandemic. In this respect, the capitalist production relations and were the environment where COVID appeared, and we have seen that the natural life and ecosystem was already destructed, and the states have become a firm. The healthcare services were already marketed, and there were deep inequalities among the different classes of the society, and we were already struggling against the many diseases and poverty. So these were the conditions where COVID appeared. So there is can be fit all of our lives into a house. So we have this motto of the Ministry of Health in Turkey, and they have created a code for Turkish citizens using this motto. But we see all people in a line in this picture. This is most probably taken at a time where it was forbidden for the old people to go to the streets. Yes, life is too large to be fitting into a home, but many people's life fit into a factory. Unfortunately, we see that old people do still have to work. When it comes to death toll, again, according to data from the Occupational Health and Safety Assembly, the death toll was mainly experienced by healthcare professionals, supermarket employees, textile employees, municipality employees, and mailing employees. So for instance, in the US, black people, in the UK, it was Bangladeshi people and Indian people who suffered the highest death toll. So as I said, the states have become firms. So healthcare is not recognized as a right. Since the 1980s, healthcare services have become all like a market, and it was treated like a commodity, and unfortunately favoritism is deeply felt in Turkey. I have seen this in Turkey's struggle against pandemic, and I will give you some examples during my speech. What was the response of the healthcare system to pandemic? There was a hospital-oriented approach. Isolation, quarantine, or tracking up the infected people. Such policies to prevent the spread of the outbreak were not very much favored, but instead the pandemic was struggled at the level of hospitals. Postponed healthcare services caused some death toll because diagnosis could only be given to some people in a delayed manner. And I cannot give you very detailed figures, but number of physicians and nurses per capita is very low in Turkey when compared to other OECD countries. So Turkey is ranking really low in this regard. Unfortunately, in this period, many physicians, nurses, technicians, healthcare professionals, or some other healthcare professionals who cannot get a job in the public sector because of political reasons, and they were still not assigned a post in the public hospitals, even at the time of COVID. So this is a figure belonging to Cuba. As you can see the number of beds and its change over years. We can see the impact of neoliberal healthcare policies, and this is a very dramatic example showing us this. For instance, Italy, UK, Sweden, Brazil, they were not very much successful at struggling against COVID pandemic. So the number of beds in those countries has gone low. But in Cuba, that number has remained the same, and it has shown an increase. At the beginning of this pandemic in March last year, based on the feedback we heard from the healthcare professionals, we got an idea about the preparedness of the healthcare facilities, and we also got an idea about the healthcare professionals' access to personal protective equipment. Rosa, she also mentioned that the whole world had this problem of accessing PPEs, personal protective equipment. This is something that we cannot identify with the century, because PPE is cheap, but providing your healthcare professionals with PPE shows that you value them. So, but unfortunately, this was neglected, and we have seen that healthcare facilities were not prepared against such disasters, such a pandemic. So this graphic shows us the problem of access to PPE. 60 or 14% of them had problem of accessing N95 mask. So in the in the struggle against the pandemic, we actually need a systematic approach. We have to prevent the spread of the disease in the country, within the country. We have to decrease the number of cases and deaths all, and we have to decrease the impact of the pandemic on the social functioning. And for this to happen, we need social policies. We need social policies and social public health policies. So I will focus my attention on 6 topics when I talk to you about how Turkey dealt with this pandemic, how the disease penetrated into Turkey, quarantine, isolation, protection of high-risk groups, treatment, early diagnosis, and whether or not we have protected high-risk groups were among these 6 topics. So we have stopped airline trips 27 days after China detected first case, and after Iran announced their first case, we closed our borders with them 4 days after that, and we didn't put people who have come from Saudi Arabia for their religious service, Hajj service. We didn't put them under quarantine. So we have seen such pictures. Some of them were actually put under quarantine, but they fled the quarantine conditions. The governor said that they have seized them and they have put them back to quarantine again, and emergency healthcare services help them carry their luggage to go to abroad, unfortunately, let alone preventing them from going abroad. They were getting some help to go abroad from the healthcare facilities, and these were all the statements of the minister that we heard. And so the data show us the real situation about the pandemic. In this regard, how many cases, what kind of medications are influential? Do we have enough intensive care beds? If you want to produce a good strategy, we need to rely on good data. But we don't have an efficient early diagnosis strategy. In 5 days, China developed a diagnosis test, and we first imported this from China at the beginning, but for many weeks it was only in one center that we were able to get the results. University hospitals were not given the authority to use those kits, and then Turkey started to use a test kit, a diagnosis kit of a company called Bioxen. But in the diagnosis kits, in the vaccines, we faced a discrimination. This Bioxen company is a company which is actually owned by the ministry. As you may remember, on the 6th of November, this company was created as per a decree, and unfortunately that decree also stipulated the closing down of the Public Healthcare Institute. First of all, this company used to charge 60 lira for the sale of this test kit. Then they lowered the price to 9.8 lira. So this was the first favoritism that we experienced.
So in total, regarding the overall testing strategy, what is the number of testings according to verified numbers of cases? New Zealand is a very successful country which is struggling against COVID-19 at a considerable level, and while the average is 260, it is 14 here in Turkey. According to the risk assessment on the basis of provinces, our dear colleague, Dr. Zeki Gül, wrote an article for a newspaper, and you can see the provinces in blue, and which means lower risks, but we can say that this map has not used the diagnostic testing indicators, or it is based on the geography that is full of landmines or the high rate of death among babies. But this map shows the inequalities according to provinces regarding the registration of patients. Since the very beginning, we as the Turkish Medical Association has been stating that the diagnostic codes have not been used, and these diagnostic codes have been identified by the World Health Association, and even a sophomore student of a faculty of medicine can easily know this definition. But the Minister of Health, when he made this statement, he has admitted that the cases were not shared with the public until that time. And what was the result in total, as the dear minister shared some figures on the first year of the pandemic and said about 3 million cases and about 30,000 deaths. Of course, we would like to commemorate all these people who have lost their lives. And according to the Turkish Medical Association, it is 380 of them are health officers and medical doctors. Of course, their lives could have been saved. I would like to extend my condolences to the families. Many analysts who are specialized in modeling or maths have worked very hard to show the real picture, and it shows the death average in 5 years and compares the death rate of the first 5 months period during the pandemic. You can see the black one, and it is much more than the expected deaths. And it is from the COVID-19 monitoring committee run by the CHP, People's Republican Party, and it also shows that figures are higher than the Ministry of Health. That means health is being concealed here. We know that there is a high level of suspicious death in Turkey. Regarding the research into drugs and also the treatment approach, I would like to refer to 2 articles. These are peer-reviewed, prestigious articles, and one of them was published in May, and they became visible in May, but they were withdrawn because these 2 authors are associated with some uncertainties, because these 2 articles are about the studies in multiple hospitals and in multiple centers, and these articles, of course, receive some letters from Turkey and indicating that these figures are not accurate. As a result of these responses, these articles were withdrawn. Of course, you can still access, but they are not public any longer. But the first author, when we look at the conflict of interest in one of the journals, as you can see, there are more than 10 companies, which is not easy to list, and he works for these companies either as a consultant or as a board member or as a consulting fee scientific advisory board. So we can understand that he is not an impartial scientist. And the second author is that there is no clear address, there is no Twitter followers, there is no LinkedIn followers. It is like a fake company because it has only a website with 6 staff only. And these 2 journals, which are peer-reviewed, and it says, the second author says, we have signed contracts with several governments, several hospitals, which do not allow us to publish this article. This is why we withdrew our articles, and this is why we will not be able to publish them until we receive permission from the governments. The World Health Organization stopped its activities on hydroxychloroquine as of 4th of July. Of course, there is a similar case in Brazil, Spain, and Mozambique. And chloroquine hydroxyphosphate, which examines the 2 doses of this dose, and when it is noticed that high dose is not safe, although they sent this letter to JAMA, Dr. Lacerda revealed these results, and a Twitter phenomenon on Twitter wrote that hydroxychloroquine is facing defamation, and there is an attempt to create a sense that it is dangerous because of the efforts by leftists. And I thought that if it had been in Turkey, there would have been no stop in these activities. What I can say that it turns into a policy when we look at the policies and also fake scientific arguments. As you know, Trump, when he appeared on TV, said he has been using this chloroquine for a week. As for Turkey, the research into COVID-19 is subjected to an administrative permission. Although it was only a requirement for a clinical permission, it has turned into an administrative permission. The Minister of Health sent another circular which says there is no need to obtain an administrative permission. And this article, I did try to count, it has 170 or 160 authors. The list of authors is 7 pages. It was uploaded and then was withdrawn. And the reason for this withdrawing was announced as the conflict of interest. Of course, the publication ethics problems are not limited to this issue. Unfortunately, there are 2 studies, and the Deputy Health Minister is one of the authors, and as a result of the criticisms and responses, one of them was withdrawn. We, as the Turkish Medical Association, we have 3 experts, and we prepared an assessment report from 3 perspectives, which you can access on our website, regarding the hydroxychloroquine in Turkey. On the basis of the studies, it has been discussed by the scientific committee in Turkey, and according to statements in late May, we either lower the dose or we will use alternative pills. And another member of the scientific member, Alpay Azalp, who is the head of this Infection Diseases Association, he said it should not be used. Unfortunately, on 9th of October, the Ministry of Health published a list, and which is still available to use, and it is still given to patients, and it is given to one of my colleagues who was infected, and it was given by the district health directorate at the district level. And if you are not an expert, or if you don't have any authority, it was distributed to patients. The second one is favipiravir, and there were attempts to produce its equal and its counterpart here in Turkey, and it was, of course, there were hailings and appreciations in the pro-government media, but after certain time, the Ministry of Health, the Ministry of Technology and Industry said, we have produced the local synthesis, and when other companies applied to this in March, Atabay Kimya and the Istanbul Medipol University, which was founded by the Minister of Health, has reserved this right. And although there were some parliamentary questions, we didn't get any response regarding the herd community, which we herd very often. Unfortunately, the concept of herd immunity is unacceptable because herd immunity or community immunity can be achieved through mass vaccination, because it is the advantage that the mass vaccination breaks the chain of infection. And if we want to achieve the immunization at the society level, we need to vaccinate at least 60 to 72% of the public. And if the vaccine is effective up to 80%, that means 75 to 90% of the society should be vaccinated. That means no one is safe until everyone is protected. Unfortunately, when we look at the statement of the Minister of Health, we have not received any vaccine apart from this 13 million doses. Maybe, I hope that I have misinterpreted his statement. Regarding the cost of the pandemic and the vaccination, there are some methods. For example, Oxfam uses, according to the IMF's projection back in June 2020, the total loss, the cumulative loss of economy is $12 trillion US. According to the Oxfam calculation, there is need for $70.6 billion US to vaccinate everyone in the world. That means the cost is not comparable. And when we look at the these countries which ordered vaccines, we can see that they have pre-ordered so many doses. But the good thing is that these countries do not rely on one vaccine only. And if we can make this vaccination, there is 5 doses vaccination per person in the UK, while it is not so much in other countries. And you can see the level of vaccination in Turkey. Of course, rate and also percentage is very important. And figures are also telling too much. For example, in Hakkari, 7,600 people were vaccinated already, which tells a lot. And same in Mardin, Diyarbakır, Van, or in Şırnak, in Bitlis. That means, if you remember the map of risks, we can conclude that there is a similar situation here also for this vaccination, and we can see what are the missing aspects of the vaccination. We can say that there is a lesser number of health officers, which means there is another form of discrimination. Of course, it refers to the discrimination on the basis of the vaccination in Turkey. 1 million doses is unknown. There is a company which exports this 1 million doses to Turkey, and we don't know where this $12 million US went. And it is a typical example of nepotism. This is a chart which is regularly updated by the University of Rosa Hopkins, and it shows about the hesitation about the vaccination. Unfortunately, we have a high level of hesitation, and this light green most probably says I'm ready to be vaccinated, while others says I'm not sure whether I should be vaccinated or not. And it is 1/3 of people who is not ready to be vaccinated. That also indicates that the vaccination issue has not been managed well during this last 19 years period of the AK Party. And despite the court, and we know that it is a policy that is supported by its practices. And regarding the vaccination, there is need for transparency, honesty, and openness and accountability. and which will make contributions to the building of trust. And it also shows the undermining of our activities. We have witnessed that. So, dear professor, some funerals are allowed, but some other activities are not allowed to organize. And dear Professor, Rosa Pavanelli needs to leave in 15 minutes, so can you kindly wrap it up? Yes. While the Turkish Medical Association increased the ladders of the trust, the level of trust, of course, nothing will be same as it was in the past. But when we use this term, it doesn't mean that there will be no inequalities, there will be no discrimination, there will be no call for wars resulting from the capitalism, or there will be no violation of human rights. That although we want a country, a world with no violation and with no pressure, but the point of what will be the new in the future depends on our struggle. I am optimistic. We can build a new life other than the capitalist system. Thank you all for your patience. Thank you, Professor Feride, for warning you, because Rosa Pavanelli indicated that she needs to leave in 15 minutes. And you clearly indicated the reasons for these inequalities in Turkey and in the world. I'm checking the questions, but let me begin my question first. My question goes to Rosa Pavanelli. Since she is serving as the General Secretary of the PSI, I would like to learn if she can share figures related to the highest numbers of COVID cases among public sectors. So which public sector suffers a lot from the COVID-19?
Well, thank you very much for these questions that help me also to highlight how neglected are workers in the public sector. The real count of workers who died because of COVID and those who have been infected in the health and in care system is one of the objectives that we have asked the WHO and the ILO to make it clear in celebrating this International Year for Health and Care Workers. Because this is the first, I would say, the first step to recognize, the role that health professionals play for our communities. And indeed, there are not many countries that have been able to let us know the real number of workers that have been infected. It is, these figures are, we lack these figures in the health sector. Can you imagine how we can have figures like this in other sectors that have been affected seriously by COVID? I'm thinking to transport, I'm thinking to the waste collectors, the waste sector, areas where, workers are delivering very essential fundamental services, and they had to deal with the COVID without protection. So, and in many countries, the statistics are not available for that. So one of the objectives that we have is exactly this one, to know who they are. And we're also trying to collect the names of public service workers who died in service, serving during the pandemic. This is something we did for workers during the Ebola epidemic, and we think we need to go beyond numbers and figures and give a name and a surname to all those who have been victims of this system. I think this is important also to let people understand, but above all governments, to take the right decision to invest in public services. And I wanted to highlight the fact public services have been important, essential, not only because they deliver health, education, transport, and all what we classically think are public services, but they have been crucial also in distributing and giving all the bonuses and yes, and the contributions that governments had assigned from their budget to business, even private business, company and corporates. We know that many governments, the European Union, United States, and many others have put a lot of money to support the economy, but most part of that money has gone to corporates, has gone to business, has gone to big companies. And it's just enough for us to consider how many profits, how many millions of dollars went to increase the profit of the tech giants companies or now big pharma, to understand that someone got a lot of advantages from this pandemic. And it's time that we claim that investment has to go for public services. They benefited of a lot of investment of public money to develop their research, to develop their the vaccine, for instance. All the corporates received the public funding, received public money to develop that. Well, it's now time for them to return the money that they invested. And it's now time for us to insist with government, with the financial institutions, I'm thinking to the IMF, the World Bank, and also the Regional Development Bank, to say that yes, it's time that all these corporates start paying their fair share. We don't want to hear about austerity when the recovery will start and the pandemic will be over. We don't want to hear about that because we paid already as workers, as public service workers, a lot, too much. It's time now that corporates start paying their fair share to the community. They start paying tax, and government use that money to invest in better quality public services. I'm thinking to your country, it was not many years ago that during a convention of the International Association of Mayors and Local Governments, the city of Istanbul, with the support of the government, candidates itself to be the biggest health pole in the world to receive health tourists, and promising to provide exceptional treatments and being able to provide to all of that things. I'm thinking to the many different needs that still the population in Turkey needs to be provided, be satisfied. I'm thinking to the terrible working conditions that many of your colleagues had to face on the Syrian border during years and months. I think it's time also for Turkey, as for all the rest of the world, to invest in public health as a public good. This is essential, not only to save lives, not only to provide quality services and decent working conditions for the health professionals, but it is crucial. And after the COVID-19 pandemic, we are the witness of that without quality public health systems, there's no economic growth. There's, on the contrary, the collapse of the economy. That's what we saw. And we need to really turn the corner and work to provide examples and to be bolder in saying that another kind of development is possible. We are talking now, and I finish on this, about the health crisis we are all in. And I totally agree with Dr. Aksu that we are not on the same boat. No, COVID-19 has further increased inequality and injustice, and the poorer are poorer, and very few got richer and richer. But what I would like to say is that we are now facing a health crisis, and the economic crisis is already here, it will follow. But there's the climate crisis that is going hand in hand with this terrible situation we are in. And nobody can imagine what can happen if we don't stop the attack on climate and on the planet. It won't only be a matter of heating, of, glaciers and the poles melting in the sea. But nobody can predict what will happen also in terms of new epidemics or new disease that can be developed in such a situation. This is why I think that for us, this is the moment to claim a different kind of economic system, a different kind of recognition of the role of public services, and a different system of investing and producing. I'm very sorry to leave you, but I got just 2 days ago the invitation, and I had already other commitments, so I'm very sorry to leave you. Hope we will have other opportunity in future to meet again and to continue our conversation. And of course, I'm counting on you to
Sevgili Rosa Pavanelli, çok fazla teşekkürler
Thank you very much, Rosa. We cannot thank you enough. Our audience also thanks you a lot, Rosa. We hope to see you in a longer conversation in the next days to come. Thanks a lot for the participation.
Thank you so much. Thank you. Bye.
Bye.
And keep safe.
Aslında Rosa Hanım'a gelmişti bir soru. Niye Kuzey?
Actually, there was a question to Rosa why the pandemic felt more intensely in the northern Italy. Feride Hanım, do you have any idea? Do you think why northern Italy was hit harder? I am not very much familiar with the details, but northern Italy is quite rich, one of the richest regions of the country. The elderly population is very high. The ratio of the elderly within the total population is also high there. According to an article I read, after the privatization of the elderly care homes, and there was a real correlation between the death toll in those elderly care homes and the privatization policies. That's all I can say. Well, another colleague of ours said that industrialist workers, who are mainly Chinese people, are also very much populating that region. So that's why the first infections were caused by them. And the privatization may be more there, maybe more abundant there, because the richer they got, maybe the more neglected they have become of the public health policies. That's another possibility. I'm sure there is a relation. I know that the ICU beds, intensive care unit beds, are few in number in that part of the country. But I don't know the specific situation of Italy. You are right, of course. We cannot expect you to say more than that. Thank you. And there was another publication that you referred to, Feride Hanım. You said it had many authors, a lot of them. Actually, we are talking about a hospital, publication which says that it couldn't be expected to have that many number of cases in those hospitals. So, okay, that's all we can say. There are a lot of people thanking us, and our audience enjoyed our panel a lot. And many of our participants wish that the economic system is changed as soon as possible, global peace is restored as world peace is restored as soon as possible. And we would like to thank the Conference Interpreters Association of Turkey for their contribution, and because simultaneous interpretation is, as far as we know, is quite challenging. Feride Hanım, this is all. We don't have any questions left. Şebnem Hanım, do you have any additional remarks? Well, I would like to thank the Conference Interpretation Association of Turkey for their solidarity that they shown to another professional organization. I would like to thank them a lot. And I would like to thank you, and I would like to thank the interpreters once again, so that made your speeches understandable in another language. So thank you very much. Feride Hanım, and your speech was quite fascinating. We listened to it with great attention. We are very sorry for the technical inconvenience we faced at the beginning of this panel. Can I make an announcement for tomorrow? Yes, please. Tomorrow, we are going to talk about the people who were made invisible because of pandemic. We have Şevkat Bahar Özbarış in the first session. She's going to talk about to us about this topic, and Alejandro Mendreo, the leader of the Chicha people of Peru, and another physician who fled the war conditions in Syria, Fuat Furat. Again, another physician, Enver Atelallah from Gaza, will join us. And another invisible segment of the society, a representative of LGBTI society, will also join us. So we will talk about those invisible segments of our society made more invisible because of the pandemic. Thank you very much for those enlightening speeches. Thank you very much. Have a nice evening. This was the end of our first session. See you tomorrow. Hope to see you all tomorrow. Bye-bye. Have a nice evening.
İyi akşamlar.
Çıktık yayından sanırım.
Çıktık mı?
Çıktık. Nasıl Pınar'cığım ya Rabbim. Hayır ben.
Çıktık mı, emin miyiz?
Çıktık.
En korkularımdan
Çıkmış olduk.
biridir. Bu benim ciddi korkularımdan bir tanesidir.
Hemen bakalım ne oluyor diye.